Meanwhile, health teams are on the ground in one family island community following a spike in COVID-19 cases there. The Minister of Health shares the latest on the situation there and sheds light on when the dwindling vaccine supply will be replenished. Cleopatra Murphy has the details.
A team of doctors and nurses were deployed to Inagua on Monday to deal with a spike in COVID-19 cases that Minister of Health and Wellness, the Honorable Dr. Michael Darville, says could be linked to campaigning as well as several different scenarios. Dr. Darville says officials believe the surge stems from an imported case from an island resident, but they believe the cluster is now under control.
A team was sent in yesterday, which is 3 doctors and a nurse, and an assessment is being done again. And my assessment this morning has indicated that it appears to still be a cluster of infection, but further work needs to be done to get the exact situation that's on the island in hand.
Due to limited vaccine supply, the Ministry of Health announced Monday that as of Thursday, it will no longer administer first doses of the Pfizer vaccine, and beginning October 23rd, second doses of AstraZeneca will no longer be offered, but Pfizer will be available as a second dose.
There was a little bit of a challenge as a result of the COVAX facility, where there's some 54,000 or maybe 57,000 doses that was supposed to be on the country now. There is some delay, and I was told up to yesterday that we're looking at the first week in November.
The Bahamas also awaits the second of 3 shipments of Pfizer gifted to the country by the U.S., but there is no timeline on when that will arrive. The Minister of Health, however, does not believe the country will run out of supplies before they are replenished.
We're looking at about 2 weeks. We believe we have enough supplies. But you know, in the vaccine world, people like choices. And so there may be some people who want Pfizer, and if they cannot get the first dose of Pfizer, decide to wait until the supplies are.
The Bahamas saw a peak in COVID-19 hospitalizations in September, with 190 people admitted. The country has now surpassed 21,000 COVID-19 infections and more than 600 COVID-19 deaths. While hospitalizations are down, with 141 patients hospitalized in Sunday's health dashboard, former Minister of Health Dr. Dwayne Sands has called for more drastic restrictions due to continued manpower challenges at hospitals. Darville says it is being considered, but may not be necessary yet.
In the event that we feel that we need to execute more measures, we will. But one of the things that is important is to improve surveillance. We do have a problem at the tertiary healthcare level because we feel that individuals who are positive may be coming to the institution a little bit too late, and we need to try to initiate therapies before they begin to decompensate and start to have severe respiratory symptoms.
Darville says he and the Minister of National Security have devised a strategy designed to improve surveillance amidst the pandemic because COVID-19 cases need to be under control for an economic recovery. Cleopatra Murphy, ZNS Network News.
Platforms, Facebook, Instagram, and Twitter for breaking news, live event coverage, web exclusives, and much more.